Good evening. This is All India Radio. I am Valsa Williams and with me is Reshma Tiwari with the evening news. The headlines. Prime Minister Narendra Modi calls for localized containment strategies and scaling up vaccination process to contain the COVID pandemic, reviews the COVID situation in the country. Prime Minister stresses on augmentation of healthcare resources in rural areas by adopting door-to-door testing and surveillance strategies. UIDAI says no one shall be denied vaccine, medicine, hospitalization or treatment for want of Aadhaar. Government relaxes rules for fast-tracking approvals to import cylinders and pressure vessels for storage and transportation of medical oxygen. Government augments capacity of indigenous production of Covaxin under Atmanirbhar Bharat 3.0 mission. First batch of drug 2-deoxy-D-glucose expected to be launched next week for COVID patients. COVID-19 cases continue to decline for last 12 days in the country. Recovery rate touches 83.8%. Over 326,000 new cases reported in the last 24 hours. Cyclone Taukte likely to turn into severe cyclonic storm in few hours. Prime Minister reviews preparedness, asks officials to ensure essential services. And US envoy arrives in Tel Aviv for talks with Israeli and Palestinian officials in a bid to de-escalate tensions. As the number of COVID cases is on the rise, we appeal to our listeners not to lower their guard, follow all precautions, and all those above 44 years who have taken the first dose of COVID-19 vaccine to get vaccinated with the second dose at the scheduled time. Stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, focus on hand and face hygiene. And now the news in detail. Prime Minister Narendra Modi has stressed the need for ramping up the speed of vaccination, testing and augmentation of the healthcare resources to deal effectively with the COVID-19 pandemic in the country. He also emphasized on the implementation of the localized containment strategies and the proper distribution of oxygen supply in the rural areas. The Prime Minister chaired a high-level meeting today to discuss the COVID and vaccination-related situation in the country. During the meeting, officials gave detailed presentations on the state and district level situation, testing capacities, availability of oxygen, healthcare infrastructure and vaccination roadmap. Mr. Modi said that localized containment strategies are the need of the hour, especially in those states where test positivity rate is high. The Prime Minister has instructed to scale up testing with the use of RT-PCR and rapid antigen tests in such areas. He said the states should be encouraged to report their COVID cases in a transparent manner. The Prime Minister asked for augmentation of healthcare resources in rural areas by adopting door-to-door testing and surveillance strategies. He also spoke about empowering ASHA and Anganwadi workers with all necessary tools. Mr. Modi stressed on providing the guidelines in easy language for home isolation and treatment in rural areas. The Prime Minister directed that a distribution plan for ensuring oxygen supply in rural areas should be worked out. He added that necessary training must be provided to health workers in the operation of medical equipment. He asked to ensure power supply for smooth operation of such medical devices. The Prime Minister took serious note of some of the reports about ventilators lying unutilized in storage in some states. He directed that an immediate audit of installation and operation of ventilators provided by the central government should be carried out. Mr. Modi said that India's fight against COVID has been guided throughout by the scientists and subject experts. The Prime Minister was briefed that testing has gone up rapidly in the country from around 50 lakh tests per week in early March to around 1.3 crore tests per week now.
Unique Identification Authority of India, UIDAI, has said that no one shall be denied vaccine, medicine, hospitalization or treatment for want of Aadhaar. In a statement, UIDAI said Certain news items that have appeared in media claiming that vaccination and a few other essential services like hospitalization were being denied to residents for want of Aadhaar. The authority said that in the COVID pandemic circumstances, no one shall be denied a service or benefit just because he or she does not have an Aadhaar. He said Aadhaar should not be misused as an excuse for denial of any essential service. The government has provided relaxations under Gas Cylinders Rules 2016 to fast-track approvals for imported cylinders and pressure vessels for storage and transportation of medical oxygen. Ministry of Commerce and Industry in a statement said that the government has reviewed the existing procedure for approval of global manufacturers for importing oxygen cylinders by Petroleum and Explosives Safety Organization (PESO). It said in view of the COVID pandemic, PESO will not carry out physical inspection of global manufacturers' production facilities before grant of such approval. Now, such approvals will be granted online without any delay on submission of manufacturers' particulars. The ministry said the filling permission for these cylinders will be issued based on following the relaxation in rules.
The Indian Railways has delivered more than 8,700 metric tons of liquid medical oxygen LMO in more than 540 tankers to various states across the country. The Ministry of Railways in a statement said that 139 oxygen expresses have completed their journey so far and brought relief to various states. The oxygen expresses have been delivering nearly 800 metric tons of LMO to the nation every day for the last few days. Oxygen relief by oxygen expresses has reached 13 states including Karnataka, Maharashtra, Madhya Pradesh, Andhra Pradesh, Rajasthan, Tamil Nadu, Haryana, Telangana, Delhi and Uttar Pradesh. It said 521 metric tons of oxygen have been offloaded in Maharashtra, nearly 2,350 metric tons in Uttar Pradesh, 430 metric tons in Madhya Pradesh, 1,228 metric tons in Haryana, and more than 3,084 metric tons in Delhi. The ministry said Railways has mapped different routes with oxygen supply locations and keeps itself ready with any emerging need of the states. The first batch of drug 2-deoxy-D-glucose is expected to be launched next week for COVID patients. The drug has been developed by the Defence Research and Development Organization DRDO, which recently got approval for emergency use by the Drugs Controller General of India DCGI. Informed sources of DRDO have said that larger quantities of 2-DG drug will be produced from the beginning of next month by Dr. Reddy's lab. As the drug has got emergency use permission by the DCGI, the drug will only be provided to COVID patients by the hospitals. The drug 2-deoxy-D-glucose comes in powder form in a sachet, which needs to be taken orally by dissolving in water.
The Ministry of Power has said that NTPC Limited has augmented COVID care facilities across the country. NTPC has added more than 500 beds with oxygen support and more than 1,100 isolation beds across its plants in various states. In the National Capital Region, the company has set up COVID care centers with facility of 200 oxygen-supported beds and 140 isolation beds in Badarpur, Noida and Dadri. Further, the company has set up a 500-bed COVID healthcare center at Sundargarh in Odisha, where 20 ventilators have been provided. The company has also placed orders for 11 oxygen generation plants in the National Capital Region. The government is supporting the augmentation of manufacturing capacity for co-vaccine production under Mission COVID Suraksha. The Science and Technology Ministry said under Atmanirbhar Bharat 3.0, Mission COVID Suraksha was announced to accelerate the development and production of indigenous COVID vaccines. This is being implemented by the Department of Biotechnology at Biotechnology Industry Research Assistance Council, BIRAC, New Delhi. To augment the capacity of indigenous production of Covaxin under the mission, the Department of Biotechnology had provided financial support to vaccine manufacturing facilities for enhanced production capacities, which is expected to reach more than 10 crore doses per month by September this year. The ministry said financial support is being provided as a grant from the centre to the tune of approximately 65 crore rupees to Bharat Biotech's new Bangalore facility, which is being repurposed to increase the capacity of vaccine production.
The centre has asked all the fertilizer companies to sell their old stocks of phosphatic and potassic P and K fertilizers at the old prices. The decision has been taken to support the farmers' cause and lessen the financial burden on them. The Ministry of Chemicals and Fertilizers has informed that despite sharp increase in prices of raw materials of DAP and other P and K fertilizers in the international market, prices in India were not increased by the companies till last month. The ministry added that it has taken immediate steps to tackle the emerging situation in order to save the farming community from the effects of this price rise of fertilizers. It said the issue is being closely monitored at very high levels in the government. The Union Health Ministry has said the inflow of foreign aid to combat COVID continues to be swiftly cleared and sent to states and union territories. The ministry said 10,953 oxygen concentrators, over 13,000 oxygen cylinders, 19 oxygen generation plants, 6,835 ventilators and around 5 lakh remdesivir vials have been delivered or dispatched through road and air from the 27th of April to the 14th of May this year. A dedicated coordination cell has been created in the Union Health Ministry to coordinate the receipt and allocation of foreign COVID relief material as grants, aid and donations. A consignment of 105 ventilators, 750,000 masks and respirators and other medical equipment arrived from Kazakhstan this morning. India has expressed gratefulness to Kazakhstan for the support. The External Affairs Ministry has also thanked Gilead Sciences, a U.S. biopharmaceutical company, for the gift of over 29,000 vials of remdesivir that arrived in Mumbai early this morning.
You are listening to the evening news on All India Radio. A reminder of the headlines before we move on. Prime Minister Narendra Modi calls for localized containment strategies and scaling up vaccination process to contain the COVID pandemic, reviews the COVID situation in the country. Prime Minister stresses on augmentation of healthcare resources in rural areas, adopting door-to-door testing and surveillance strategies. UIDAI says no one shall be denied vaccine, medicine, hospitalization or treatment for want of Aadhaar. Government relaxes rules for fast-tracking approvals to import cylinders and pressure vessels for storage and transportation of medical oxygen. Government augments capacity of indigenous production of Covaxin under Atmanirbhar Bharat 3.0 mission. First batch of drug 2-deoxy-D-glucose expected to be launched next week for COVID patients. COVID-19 cases continue to decline for last 12 days in the country. Recovery rate touches 83.8%. Over 326,000 new cases reported in the last 24 hours. Cyclone Tauktae likely to turn into severe cyclonic storm in a few hours. Prime Minister reviews preparedness, asks officials to ensure essential services. And U.S. envoy arrives in Tel Aviv for talks with Israeli and Palestinian officials in a bid to de-escalate tensions. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
Welcome back to the evening news. The Union Health Ministry has said the country is witnessing a continuous decline in the number of active cases of COVID-19 and increase in recovery rate over the last 12 days. Addressing the media in New Delhi, Joint Secretary in the Health Ministry, Love Agarwal, said the active cases have now come down to 15.1% from 17.1% since the 3rd of this month. The recovery rate also improved further from 81.7% to 83.8%. He said in the last 4 to 5 days the recovered cases have surpassed the active cases being reported across the country. He stressed that intensive efforts should continue in states with higher number of cases, as 11 states have more than 1 lakh active cases and 8 have 50,000 to 1 lakh such cases.
पिछले ऑलमोस्ट 4 से 5 दिनों में हम देखते हैं कि हमारे रिकवर्ड केसेस एक्टिव केसेस से बढ़कर आ रहे हैं और हमारी एवरेज वीकली रिकवरी में भी 11% इम्प्रूवमेंट हुआ है। 75% हमारे केसेस अभी भी 10 स्टेट से आ रहे हैं और 80% एक्टिव केसेस 12 स्टेट्स में हैं। 1 लाख से अधिक एक्टिव केसेस अभी 11 स्टेट्स में हैं। 50,000 से 1 लाख एक्टिव केसेस 8 स्टेट्स में पाए जा रहे हैं और 17 स्टेट्स ऐसी हैं जहां 50,000 से कम एक्टिव केसेस हैं।
He also informed that there are 24 states including West Bengal, Haryana, Kerala, Andhra Pradesh and Odisha where the positivity rate is more than 15% and 10 states are those where the rate is between 5 to 15%. On the status of vaccination, Mr. Agarwal said that India's cumulative vaccination coverage exceeds 18.04 crore. The Health Ministry said over 3,53,000 patients have recovered from this infectious disease within 24 hours. The country has registered over 3,26,000 new COVID cases during the last 24 hours. Meanwhile, over 18 crore 4 lakh COVID vaccine doses have been administered to beneficiaries across the country so far. The Health and Family Welfare Ministry said over 11 lakh vaccine doses were administered to beneficiaries within the last 24 hours.
Dr. Mohan Bhagwat, Sar Sanchalak of Rashtriya Swayamsevak Sangh RSS today said, Corona pandemic is a catastrophe for humanity and we must work in unison by leaving aside all disagreements between us. Dr. Bhagwat was addressing an online lecture under Hum Jeetenge Positivity Unlimited lecture series organized by COVID response team. He said, we will definitely overcome this situation with firm determination, perseverance and continuous efforts.
पूरे भारत को एक समूह के नाते सारे भेद भूलकर दोष गुणों की चर्चा अभी उसको विराम देकर उसके लिए बाद में समय मिलेगा। अभी तो हमको सबको एक टीम के नाते काम करना है, मिलकर काम करना है।
He urged people to keep themselves healthy by adopting a healthy diet, yoga and exercise. Dr. Bhagwat also appealed to the people to verify the information on social media on scientific basis. He stressed upon the importance of public awareness and public training in this challenging time. In the Union Territory of Jammu and Kashmir, 63 persons died due to COVID during the last 24 hours till 5 p.m. today. With this, a total of 3,090 deaths have taken place in the Union Territory till date. Of the 63 deaths, 37 deaths took place in Jammu Division, while 26 persons succumbed in Kashmir Valley. Meanwhile, 3,677 new positive cases, 1,728 from Jammu Division and 1,949 from Kashmir Valley have been reported during the last 24 hours.
In order to break the virus chain, the Himachal Cabinet has decided to extend the corona curfew to the entire state till the 26th of this month. This was decided in a state cabinet meeting held in Shimla today under the chairmanship of Chief Minister Jairam Thakur. While reviewing the COVID-19 situation, Chief Minister Jairam Thakur expressed concern over the sharp surge in the number of COVID-19 cases in the state. Meanwhile, the state government will constitute a pediatric task force to study the overall scenario in view of the anticipated third wave of COVID-19. Our correspondent reports that the state has started enhancing its health infrastructure preparedness for the third wave of the pandemic, which is likely to infect children.
The state government is drawing up plans to prepare for third wave, which health experts warn could hit children. In view of this, state government has decided to form a pediatric task force to study the overall scenario and to give its recommendations. The task force will study the availability of medical infrastructure in various types of intensive care units and pediatric COVID wards for young children. State government health spokesperson Dr. Nipun Jindal informed that the government is acting proactively to strengthen the facilities so that the situation may be handled in the best possible way in case the anticipated third wave strikes the state. Sanjeev Sundariyal, AIR News, Shimla.
Delhi Chief Minister Arvind Kejriwal today said there will be oxygen concentrator banks OCB in every district of Delhi. Addressing a press conference, Mr. Kejriwal said it is essential to provide oxygen to COVID patients on time. He said the government has started this free-of-cost facility for such patients. Mr. Kejriwal said every district in the National Capital Territory will have an oxygen concentrator bank with at least 200 oxygen concentrators. He also highlighted that the team will provide the concentrator at the doorstep of patients in home isolation if needed. The Chief Minister also said 1,000 ICU beds were added in the last 15 days and positivity rate has now reduced to 11% in Delhi.
Odisha government has floated a global tender to procure vaccines for COVID-19. Briefing media in capital Bhubaneswar today, Chief Secretary Suresh Chandra Mohapatra said that the government targets to procure 3 crore 80 lakh doses of COVID-19 vaccines from the manufacturing companies over the next 4 months. A report.
COVID-19 vaccine producing companies both within and outside the country can submit their bids by the 28th of this month in response to the e-tender, said Mr. Mahapatra. Appealing people to abide by COVID-19 protocol, he disclosed the fact that about 8,000 COVID-19 patients were admitted to the hospitals on any given day during the peak period of the first wave last year. However, he made it clear that this time around, about double the number of COVID patients are undergoing treatment in different hospitals across the state, with at least 3,000 patients admitted into ICUs or are on ventilators. Meanwhile, COVID-19 cumulative case load of the state has overshot the 6 lakh mark today, with a detection of about 11,815 fresh infections during the last 24 hours. Girish Chandradal, AIR News, Bhubaneswar.
Mumbai continues to witness a consistent decline in COVID cases. According to the Health Department of the BMC, 1,447 new cases and 62 deaths due to the viral infection were registered during the past 24 hours. More than 2,300 patients were discharged from the hospital following their recovery. The recovery rate in the city stands at 92%. The BMC officials said 24,896 tests of COVID-19 were done today. The overall growth rate in the city from 8th to 14th of this month has been 0.32%. The West Bengal government has imposed some more stringent restrictions in the state for 2 weeks from tomorrow as a precautionary measure to protect the health of the general public in the wake of rising corona infection in the state. Chief Secretary Alapan Banerjee told a virtual press conference from Navana today that all government and private offices would be closed except for emergency services.
Prime Minister Narendra Modi chaired a high-level meeting today to review the preparedness of states and central ministries and agencies concerned to deal with the situation arising out of Cyclone Tauktae. The Prime Minister directed senior officers to take every possible measure to ensure that people are safely evacuated by the state governments. He instructed to ensure maintenance of all essential services such as power, telecommunications, health and drinking water, among others, and also asked for their immediate restoration in the event of damages. Mr. Modi also spoke about the need to involve the local community for timely sensitization and relief measures. The Cabinet Secretary is in continuous touch with Chief Secretaries of all the coastal states and central ministries and agencies to assess preparedness with regard to Cyclone Tauktae. The Union Home Ministry is reviewing the situation 24/7 and is in touch with the state governments, union territories and the central agencies concerned. The NDRF has said that 53 teams have been committed to handle Cyclone Tauktae, of which 24 teams have been pre-deployed and 29 teams have been kept on standby. The deployments have been made across 5 states, namely Kerala, Karnataka, Tamil Nadu, Gujarat and Maharashtra. Meanwhile, the Indian Air Force has kept 16 transport aircraft and 18 helicopters on operation readiness in Peninsular India in preparation for the Cyclone Tauktae. The cyclonic storm over the east, central and adjoining southeast Arabian Sea moved north-northwestwards with a speed of about 11 kilometers per hour during the past few hours and is now centered over east, central and adjoining southeast Arabian Sea. The storm is very likely to intensify further into a severe cyclonic storm during next 6 hours and into a very severe cyclonic storm during the subsequent 12 hours. Talking to AIR, IMD head forecasting R.K. Jainamani said that due to cyclone, the widespread rain will lash Maharashtra, Karnataka, Goa and Gujarat in the coming days.
the main red color warning we have given for Karnataka and Goa tonight and tomorrow. And then for Maharashtra coast, we have given for tomorrow 16 and 17 forenoon for heavy rainfall only. And then for 17th evening and night, the rainfall will start from Gujarat. So Gujarat has a warning for the 17th, 16th afternoon to onward, and the main impact will be the 17th with the extremely heavy rainfall, Junagadh and Gir Somnath, and then subsequently on 18th it is Porbandar, Dwarka, Jamnagar and Kutch. And all these areas right from the Lakshadweep to Gujarat, the fishing has been completely banned for next 3 days.
Heavy rain continues to lash across Kerala and Lakshadweep as Cyclone Tauktae intensifies. Our correspondent has more on this story.
Red alert is issued in 9 districts and orange alert in the remaining districts. Heavy to very heavy rainfall and strong winds is predicted in the state till tomorrow. Widespread damage and sea erosion have been reported in the state today. Central Water Commission has cautioned river flooding in areas where water level has increased after today's heavy rain. Nearly 2,000 people are shifted to 68 relief camps across the state. National and state disaster response forces are coordinating the relief measures along with naval and coast guards. Mayush Shah, AR News, Thiruvananthapuram.
Cyclonic storm Tauktae is 250 kilometers southwest of Goa and is heading towards Gujarat. Senior Regional Meteorological Department official Ms. Shubhangi Bhute said. She said the cyclonic storm will make a huge impact in the Konkan region, which includes parts of Goa and Sindhudurg and Ratnagiri districts of Maharashtra.
The IMD officials in a virtual meeting with senior officials of the BMC, state government and NDRF categorically stated that areas which comes under the jurisdiction of Mumbai Municipal Corporation have no threat from the cyclonic storm Tauktae. However, they said that since the cyclone will cross from the sea near Mumbai, it will lead to gusty winds and rainfall. They said today the wind speed will be around 40 to 50 kilometers per hour, which will increase to 60 kilometers per hour tomorrow. The IMD officials further said that at some places the wind speed might touch 80 kilometers per hour. The BMC has appealed to the people not to step out of their houses on both these days. The BMC has also ordered to remove hoardings in the city which are deemed to be dangerous. Kunal Shinde, AIR News, Mumbai.
Cyclonic storm Tauktae is likely to cross the Gujarat coast between Porbandar and Nalia around 18th May. According to sources, the cyclonic storm will be a very severe cyclonic storm from the 16th to the 18th of May. AIR Ahmedabad correspondent reports that Gujarat Chief Minister has held a high-level core committee meeting to review the state preparedness in view of severe cyclonic storm Tauktae. More from our Ahmedabad correspondent.
Gujarat Chief Minister Vijay Rupani has called a high-level core committee meeting in Gandhinagar to review the state preparedness in view of severe cyclonic storm Tauktae. He has directed the state administration to take all necessary steps with zero casualty approach. All district collectors in the coastal region have been asked to ensure the safe return of fishermen who went in the sea. Mr. Rupani also asked to make special arrangements for COVID patients taking treatment in the coastal areas. The coastal districts of South Gujarat, Saurashtra and Kutch region have been asked to remain on high alert. Yogesh Pandya, AIR News, Ahmedabad.
A U.S. envoy has arrived in Tel Aviv for de-escalation talks as unrest between Israel and the Palestinians continues. Hadi Amir will take part in talks with Israeli, Palestinian and UN officials and reinforce what U.S. diplomats said was the need for a sustainable calm. Israeli airstrikes on targets in the Gaza Strip killed 10 people today, while Palestinians fired rockets into Israel. This week's violence in Gaza and Israel is the worst since 2014. At least 150 people have been killed in Gaza and the West Bank and 8 in Israel since the fighting began. An estimated 10,000 Palestinians have left their homes in Gaza since Monday because of the conflict, according to the UN. Israeli officials reported about 200 rocket launches from Gaza overnight, with homes hit in the cities of Ashdod, Beersheba and Sderot.
And now, before we end the bulletin, the headlines once again. Prime Minister Narendra Modi calls for localized containment strategies and scaling up vaccination process to contain the COVID pandemic, reviews COVID situation in the country. Prime Minister stresses an augmentation of healthcare resources in rural areas by adopting door-to-door testing and surveillance strategies. UIDAI says no one shall be denied vaccine, medicine, hospitalization or treatment for want of Aadhaar. Government relaxes rules for fast-tracking approvals to import cylinders and pressure vessels for storage and transportation of medical oxygen. Government augments capacity of indigenous production of Covaxin under Atmanirbhar Bharat 3.0 mission. First batch of drug 2-deoxy-D-glucose expected to be launched next week for COVID patients. COVID-19 cases continue to decline for last 12 days in the country. Recovery rate touches 83.8%. Cyclone Tauktae likely to turn into severe cyclonic storm in a few hours. Prime Minister reviews preparedness, asks officials to ensure essential services. And with that, we end the evening news. Good night.